Should I fix scalp calcification or fibrosis before hair transplant? My second hair transplant of 4,400 grafts is a failure, with 15 to 20% yield. I'm about to have a third hair transplant. I believe fibrosis or scalp calcification could be a reason. How do I find out if this is the cause? Should I apply magnesium oil until the day before the transplant? Is there anything I can do to make the hair transplant a success this time?
Thank you for your question. You submitted your question without a photo, but you describe a situation in your question where you underwent 4,400 graft hair transplant, but you described it as a failure because it was a 15 to 20% yield, and that there is a significant possibility that there was underlying scalp fibrosis and calcification. And you want to know how do you figure out if that's the case, and you're about to undergo a third hair transplant, and you're asking about maybe using magnesium oil prior to this hair transplant. Well, I can share with you my perspectives on your situation and a little bit about our experience in comparable situations in our practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic and reconstructive surgeon. I've been practicing in Manhattan and Long Island for over 20 years. Hair transplant has been a big part of my practice for many years. I'm also the founder of TrichoStem Hair Regeneration Centers, a system we developed that non-surgically helps men and women with genetic pattern loss, and we use regenerative medicine technology that may be applicable to the situation that you're currently in. So, to begin with, this unfortunately it occurs more commonly in terms of the low yield of transplanted hairs than is often presented in the transplant industry. We've had patients who have had mega sessions and had more than 90% of their grafts not grow, and these patients weren't done in our practice, but they came to us and it was practically like they had no hair at all. So it's entirely a possible situation. You know, when I describe to my patients who have undergone transplant elsewhere or have come to me for additional opinion about transplant versus hair regeneration, which I'll describe later, I explain to them first, understand that the process of transplantation intrinsically is fairly traumatic. When people say I've had 1,500 grafts, 3,000 grafts, or in your case 4,400 grafts, well, you've had 4,400 stabs made into the scalp, and intrinsically there's going to be vascular compromise, there's going to be inflammation, and all of those variables can play a role. Now, the fact that you had a previous transplant is significant. There is scarring that occurs with every transplant, and it can have a certain compromise in the integrity of the tissue. Now, many patients have come to us from around the world for this treatment we call hair regeneration. Now, hair regeneration was a discovery that we made based on the use of a wound healing material when we were doing a lot of hair transplants. Basically, what we found was that thinning hairs became thicker. We were using a wound healing material to improve the outcomes in terms of graft survival as well as the healing of the donor area. Well, once we started using it for pattern genetic loss without surgical transplant, it actually created essentially now a new category to help people with thinning hair who would have previously gone for hair transplant. Now, as a cosmetic surgeon, I've been using this material for rehabilitation of tissue. So, for example, patients have come to me who have had multiple eyelid surgeries and they've developed scarring and contraction and other issues. Well, before doing another surgery, I'll actually do what I refer to as tissue rehabilitation. And what I do is I'll use PRP, platelet-rich plasma, which is derived from your own blood, which is a concentration of the wound healing and growth factors that is necessary when you have a cut, as well as acellular matrix. And essentially what I believe is going on is that we're making, and I could see it from the external perspective, the tissue gets healthier, improves vascularity, improves the quality of the tissue. And so one of the things I would consider in your situation would be first tissue rehab before doing another transplant. Another relevant example is patients who have had transplants done elsewhere have come to us in a window of within the first 3 months of having surgery. And in those patients, we've actually helped expedite their healing, and we've observed that their grafts actually grow sooner. Now, it is a difficult thing when you manage patients who have had transplants elsewhere. And sometimes I'm a little bit more cautious because if they've had a second or third transplant, we want to be strategic. Sometimes I'll tell the patient, let's see how well these grafts heal, and then maybe after a year, when the grafts have healed, we can help you with management of the scalp in terms of the existing hair to try to preserve and prolong the lifespan, as well as the tissue quality to help with the grafts once they've settled in. So there's certainly no specific right answer to your question. I think that the magnesium oil placement will have limited value because if just the anti-inflammatory potential benefit is not enough to create healthier tissue. Remember, it's a hair graft. You're moving skin, bearing hair, to skin, and you need blood supply. You need the tissue to heal. After multiple surgeries, the fatty cell layer under the skin, the scar tissue and other things can actually be compromised to a level which can affect the impact on the hair graft yield. In addition, of course, we also want patients to have their blood pressure checked, as well as be on off of anti-inflammatories, which can be blood thinners, but I think that's probably already covered. So I think that it's important for you to actually learn about PRP, hair regeneration, this emerging stem cell-based technology to help with tissue rehabilitation to maybe help improve the graft yields for future surgeries. I think this is something to discuss with your hair transplant doctor, and just remember your donor area, and probably you might be even going beyond the donor area and going into body hair at this point, is going to be limited, and every hair that doesn't take is a hair that's lost. So make your decision very carefully. So I hope that it was helpful. I wish you the best of luck. Thank you for your question.